I'm Dr. Alex Samuel, Health Director for the Chesterfield Health District. Looking at the calendar earlier this week, it dawned on me that public health has been responding to this pandemic since mid-February, which means we've been directing most of our energies towards COVID-19 for 6 months now. Everyone listening to this has been living and doing their best to adapt to a complicated set of circumstances that are changing frequently. We will get through this. And from our perspective at the local health department level, we're beginning to feel more comfortable about our essential areas of focus, at least for the next 4 to 6 months. These include containment, which refers to separating those who are infected or potentially infected with COVID-19 from the rest of the population until they're better. The key ways to do this is through case investigation and contact tracing, which leads to isolating those who are sick and quarantining those who are exposed. Another area of focus for us is providing free testing to those who are vulnerable to exposure and who have limited access to healthcare. We're also providing guidance and support to schools, businesses, long-term care facilities, and local governments about prevention and control as reopening continues. Another area of focus for us in the future is supporting enforcement activities related to the executive orders that have come out. And finally, preparing to dispense COVID-19 vaccinations when they become available is something that we're eventually going to be focusing on quite a bit. That hopefully sometime late this year or early next year. Now, if you throw in a hurricane response activity and flu season, the picture becomes more complete. So I'll circle back to some of these areas of focus a little later on. But first, let's look at our numbers. Now, all of the data I'll be talking about comes from the VDH COVID-19 data web pages, which can be accessed at www.vdh.virginia.gov. You'll just need to navigate to the COVID-19 data pages from there. So I'll be speaking primarily about data relevant to Chesterfield County. Over the past 2 weeks, our case numbers have dropped from an average high of 48 new cases per day on August 6th to an average of 42 new cases per day on August 13th to an average of 35 cases per day noted today. That's a 27% decrease in average daily case numbers in 2 weeks, which is good news. Percent positivity, which is a general measure of testing capacity, is calculated by dividing the total number of daily tests by the number of daily positive tests, has been steadily decreasing as well over that same time frame. Percent positivity for the state of Virginia reported at 6.5% right now, and currently, for the health district, we're at 6.2%, down from around 9% 2 weeks ago. The goal again is to remain below 10%. For those interested, the value for the US reported 3 days ago on August 17th was 9%. Recent hospitalization numbers for the county have been low and fairly stable. Regional hospitalization numbers, which include the greater Richmond metro area, are still, and they're a better measure of hospitalization trends, have been fairly flat as well. All of these trends are consistent with those seen in the other districts that comprise the greater Richmond metro area. This is generally good news, perhaps indicative of a tapering of the increase in community transmission that we've seen recently and was expected 4 to 6 weeks after reopening began in more earnest on July 1st. However, we can't afford to let our guards down. As more workplaces bring employees back, as some schools and colleges begin to bring students back, and as cooler weather brings people indoors, we can expect to see an increase in cases, which means that physical distancing, face coverings, hand washing, and appropriate cleaning will continue to be part of our lives. I invite you to head to the VDH website and spend some time on the data pages there. There's a data insights page that offers additional data analysis, a look at cases by zip code, and projections about future case numbers using the UVA COVID-19 model, which is something I plan to delve into deeper in a future recording. I'm going to switch gears a little and talk about the COVID-Wise smartphone app that's now available and has been getting some press attention. COVID-Wise is a downloadable smartphone application developed by Google and Apple. It's intended to help users know about possible exposures to COVID-19 through a unique system of communication between cell phones. Its ultimate purpose is to help people quickly determine if they need to self-isolate or obtain their own COVID-19 test. Early detection and isolation allows for fewer contacts and reduces the risk of transmission to others. So how does the app work? Upon receiving a positive test notification about a COVID-Wise user, BDH administrators generate a randomly changing code to the user's cell phone. This signal is then regularly transmitted via Bluetooth to the phones of other nearby COVID-Wise users without divulging personal information or exact location. It's really an anonymous voluntary contact tracing network. If a user's smartphone comes into close proximity with another COVID-Wise user who has reported a positive test, the first user will receive a potential exposure alert. COVID-Wise uses Bluetooth low energy technology to quickly notify users who have been potentially exposed so that you can reduce the risk of infecting your friends and family until you get more information from health department staff. So here are the steps to obtaining and begin using COVID-Wise. Step 1, download the free app from the iPhone App Store or Google Play Store. Step 2, once you opt into the notification system, the exposure notification system will generate an anonymous token for your device. To help ensure these anonymous tokens can't be used to identify you or your location, they change every 10 to 20 minutes. Step 3, the app works without draining your cell phone battery or using your data by exchanging these privacy-preserving anonymous tokens via Bluetooth low energy technology. This is a passive process that begins once you opt in and functions without the app needing to be open. Step 4, on a daily basis, your phone downloads a list of all the anonymous tokens associated with positive COVID-19 cases and checks them against the list of anonymous tokens it has encountered in the last 14 days. If there's a match, the app will notify you with further instructions from public health on how to keep you and the people around you safe. Finally, I'm going to return to those areas of focus that I mentioned earlier for those of us here at the health department and how we're working to adjust our staff to accommodate some of these areas. Under normal, non-pandemic operating conditions, our work units are focused on providing clinical services, environmental health services, communicable disease control services, with our administrative staff supporting all of these. During the pandemic, we've been maintaining these services at reduced levels in order to direct most of our staff resources toward the COVID-19 response activities I mentioned earlier. Moving forward, we're hoping to expand many of our COVID-related teams while returning as many staff as possible back to their regular duties. This balancing act requires bringing on and training additional staff, primarily in temporary positions. With regard to the containment activities mentioned earlier, we've been working to expand our numbers of case investigators and contact tracers. We're getting a steady number of case investigators and contact tracers onboarded, though we could use more with a special need for Spanish speakers. If you go to the BDH COVID-19 webpage and scroll all the way down, there's more information about these positions, including job descriptions. We'll also be doing more COVID-19 focused community outreach and education to vulnerable populations in the community at large. This team is looking to hire a care coordinator who can help direct folks who test positive and have been asked to self-isolate or quarantine to resources that will help them do so. Isolation or quarantine can be especially challenging for individuals and families with limited means. The need for ongoing community-based testing requires that we add more staff to our current community testing teams. We'll need more nurses and support staff as we expand these operations. Eventually, we'll also need teams to provide COVID-19 vaccinations to the community at large when these become available. Although we don't yet know our exact staffing needs, we'll certainly need nurses and support staff for these operations. Our goal is to eventually have several fixed vaccination sites in the district. Recruitment for these positions are processed through temporary employment agencies, and the duration of contracts will vary from a few months, potentially up to a year or more. Each new hire must pass a state background investigation and could require professional credentials depending on it. Serious inquiries about these positions can be directed to our local health emergency coordinator, David Woods, who can be reached at the following email address: david.woods@vdh.virginia.gov. So that seemed like a lot. I'll stop for now. All of us are continuing to adapt to the constant changes that keep coming at us. So we at the health department will work hard to do our part, and I'll ask you to do the same. Until the next time, stay well. Thank you.